A look at the Japanese culture. The Japanese culture has distinct beliefs and practices that change the way healthcare providers deliver and treat illness across the lifespan for Japanese patients, as well as influence how the Japanese manage and define their own health. In order to provide culturally competent and congruent care, healthcare professionals need to be aware of different cultural influences that impact quality of care and quality of life in the Japanese culture. With over 1.3 million Japanese individuals living in the United States and the highest life expectancy, nurses need to be prepared to meet the demands of these individuals. Further exploring beliefs and practices of childbearing women and their families, children, adults, older adults, and communities of the Japanese culture can increase awareness of the healthcare needs specific to the Japanese culture. The cultural attributes of Japan. Japan, or Nippon, is known as the land of the rising sun. Their official language is Japanese, and there are two dominant faiths, Shintoism and Buddhism. The total population in Japan in 2015 was over 120 million people. Japan has the highest life expectancy in the world. For Japanese families, there is much emphasis placed on family interdependence versus self-reliance and independence. The expectation is that family will care for sick and older family members. Modesty is crucial, especially for women and the elderly. In providing care, we might want to consider utilizing a same-sex nurse or nursing assistant to preserve modesty. Buddhist patients, especially first-generation Japanese Americans, may utilize prayer beads in a healthcare setting. Japanese beliefs regarding health vary between two dominant religions, Shintoism, which views illness and disease as unclean and impure, and Buddhism, which views aging and illness as a natural process. Many Japanese embrace Buddhism later in life, and end-of-life treatment and funeral rituals are often practiced according to Buddhist beliefs in Japan. Illness stems from an interruption of flow to ki, or energy. The flow of ki can be restored utilizing herbs and shiatsu massage. Acupuncture is used to reduce pain and eliminate toxins from the body. Many Japanese, however, practice a combination of both Western and traditional medicine. The Japanese definition of health refers to cleanliness and hygiene, which are very important and directly linked to purity and good health. Poor health is considered shameful and must be communicated as something that could not have been avoided, especially in terminal illness. Traditional East Asian medicine is based on holistic principles that view the human organism in terms of its integration with the social and physical environment. A healthy body must maintain a dynamic balance. Treatment ideally addresses all aspects of a person's condition, from diet and sleep to exercise, personal habits, and work. The goal of therapy is to preserve or restore that balance, to enhance the flow of ki. Japanese families are generally small, but it is not uncommon for an aging parent to live with their child. Many marriages are based on love, but there are still traditional arranged marriages as well. Some people still use matchmakers to help them find a mate. Women typically have a child within a year of marriage, and it is uncommon for couples to not have children. Fathers are usually less involved with raising the children, and 30 days after birth, infants are taken to Shinto shrines to receive a purification ritual. The childbearing woman in Japan. The average age of pregnant Japanese moms is 30.4 years of age. Maternal and infant mortality rates are among the lowest in the world in Japan, making Japan one of the safest places to deliver a child. The recommended weight gain during pregnancy for expectant moms is 7 to 8 kilograms. That's only about 15 to 16 pounds, and significantly is less than the suggested weight gain for expectant moms in the Western world, which is about 10 to 14 kilos, or 22 to 30 pounds. Japanese midwives often suggest that bellies and ankles must be kept warm and covered at all times. It is believed that if the belly gets cold, the baby will catch a cold. The ankles must be kept covered with socks to keep pressure points of the ankle warm, because it is believed that these pressure points are connected to the uterus. Also in Japanese culture, it is recommended that the woman stay in the hospital 5 to 8 days after delivery to ensure rest and recovery after childbirth. Abortion is rare and not permissible in Japan. Shame is brought to the family of an unwed mother. The children of Japan. Infants are reviewed as very important, and caring for children is considered to be a woman's greatest responsibility. Children usually have stronger bonds with their mothers as opposed to their fathers, and Japanese Americans will sacrifice their own health for the health of their children, because they are the future generation. Children are considered very impressionable, passive, and meant to be molded and guided. Japanese values, tradition, and customs are involved in the raising of their children. They are taught to be reserved and control their emotions. Many schools require rigorous entrance exams and are very competitive. This leads to stress and anxiety and bullying. There can be difficulty re-entering the Japanese school system if the child has studied in another country. Children may smile when embarrassed or confused. Asking questions to clarify understanding and meaning is most important when caring for these children. 80% of Asian infants are born with Mongolian spots, which are easily mistaken for a bruise. Kawasaki syndrome is the leading cause of heart disease in Japanese children ages 0 to 4 years old. Family is referred to as kazoku in Japan, and it is important to the Japanese culture. The eldest male of the family is considered the head of the family and is in charge of making major decisions and finances. The wife of the head of the family is in charge of the house and major decisions of the women in the family. Wives and daughters of the eldest son are expected to be caretakers, including personal care when hospitalized. Confidentiality and respect should be maintained by all healthcare providers. Breaching either could cause shame to the family, because poor health is considered shameful in the Japanese culture. Japanese adults do not like to show weakness or inadequacy. As a result, multiple approaches may be needed when offering medications, such as pain medication. It is not uncommon for Japanese adults to utilize herbs when sick. This should be taken into consideration when giving medications as well. Japanese adults may also practice religious ceremonies at the bedside of ill patients. Japanese Americans are susceptible to colon, rectal, and stomach cancers, stroke, and hypertension. Approximately 210 minutes a week, or 30 minutes a day, of vigorous exercise is recommended for colon cancer prevention. Many Japanese adults do not effectively meet these recommendations due to lack of available physical equipment, not seeing the benefits of exercise, and low self-efficacy. In regards to mental health, Japanese Americans often avoid seeking help for mental health illnesses to maintain family honor. Japanese food. Rice is considered a dietary staple in the Japanese diet. Appealing visual presentation of the meal is valued. Asian Americans are known to have the lowest obesity rate. Japanese communication. When communicating with Japanese, indirect communication is important. Things like eye contact, gestures, and silence are examples of indirect communication. Japanese adults do not typically ask direct questions to be polite. Politeness is valued. Japanese adults may also smile, nod their head, or say yes but not agree with or understand what is being said. So it is imperative that we make sure we are effectively communicating. Japanese adults believe in on, which is translated as caring for someone who has cared for you in the past and sharing memories with them. For example, care they give their loved ones with cancer reflects love, but it also is a way to repay the love the person has given them in the past. Enri, or meiwaku, can be defined as self-restraint and a fear of bothering other people. So even when they needed assistance from others, some will not ask for help from family or friends. Understanding this concept will help nurses identify the fact that caregivers may not express caregiver burden and stress. The caregiver most likely will not reach out to family for help. Also in the Japanese culture, it is common for a doctor to share news about a patient's condition with the family instead of with the patient. The family then makes the decisions about the patient's care together, and it is common for patients to not know the seriousness of their own illness, including when they are terminally ill. So during a cultural assessment, a nurse should inquire if the patient wants to know information about his or her health, or if the healthcare team should speak with the family instead. Omiyari is defined as having a strong empathy for the patient's thoughts and feelings. This empathy is obtained through spending time with the patient and careful observation instead of direct verbal expression of thoughts and feelings. Inori means to pray to either gods, ancestors, or deceased family and close friends. Japanese caregivers describe commonly praying to or talking with Buddha, ancestors, or friends. They even reported imagining conversations as a means to cope with the stress of caregiving. Nurses should also be aware that the concepts of not asking for help can lead to horrible results. 1% of suicides in Japan are attributed to caregiver burden and fatigue. Nurses should assess for signs of burnout and utilize other members of the interdisciplinary team like social work to assist patients and caregivers. Elderly Japanese reported having a good death experience if they knew that their death would not burden their family in any way. Japanese people believe that burdening their family can have both physical and emotional negative implications. Physical, meaning having family members having to take care of them, and emotional, family members having to make the difficult decisions. Preparation before death could lessen the burden through living wills and trusts, funeral planning, and moving to a long-term care facility or retirement home. Many Japanese start planning and preparing for their own funeral at age 60. The National Health Insurance Act, established in 1961 in Japan, allows for anyone to obtain appropriate health care anywhere at any time. Japanese citizens must be covered by insurance. Nurses in Japan are typically public health nurses, midwives, nurses, and nurse assistants. Public health nursing focuses on caring for patients, observing the course of illness, assessing functional status, reporting the patient's condition, health promotion and disease prevention, teaching about health and illness, care management strategies, and one of the main things that public health nurses do in Japan is coordinating community resources to assist families in the care of their family members. In summary, cultural beliefs and practices influence how healthcare providers deliver and treat illness, as well as impact how those individuals manage their own health. The Japanese believe in a holistic approach when managing and defining the health of children, adults, and elderly. Family, religion, food, exercise, communication, and personal habits should all be considered when caring for a Japanese patient across the lifespan. Healthcare providers must also preserve modesty, show respect, and avoid putting shame or burden on the Japanese patient and their family. Understanding the unique beliefs and practices of the Japanese culture can allow nurses to provide culturally competent and congruent care to the Japanese patients across the lifespan. Thank you.